Hi everyone, I'm Kim Barnes with FYI Austin. Shorts and swimsuit season is almost here, so if you're a little concerned about baring your legs this summer, listen up. Dr. Stephen Bunker, he's a radiologist, is here with us. We're going to talk about varicose veins, not something that some of us like to admit we need to talk about, but we do. So tell us who's at risk.
Well, the highest risk group is probably those with a mother, father, grandmother, or grandfather that has vein disease, so genetics is a big factor. Then women are twice as likely to develop vein disease than men. Women who've had multiple pregnancies, who may be weighing more than they should, exercising less than they should, or those people who spend prolonged periods of time on their feet.
So what are the treatment options?
Well, historically, the treatment was the classic vein stripping. This was something that required general anesthetic. The vein was literally pulled out of the leg, and the recovery period was up to 2 weeks or more.
And now they're in and out really quickly?
Right. 21st century technology has sort of caught up with this old disease, so now it's an outpatient procedure. The patients walk in, they're awake the entire time for about a 30-minute period or so, and they walk out. And most people can return to their normal activities within 1 to 2 days.
Very fast. Yeah. So if you're not sure if you're a candidate, what's the process?
Well, our office offers a free screening, and if appropriate, then an ultrasound examination is done of the legs. Ultrasound technology is pretty spectacular. It's the same technology that evaluates the fetus in the womb, but it now measures, in this case, the backwards flow, which is abnormal of veins in the legs. If this backwards flow is sufficient, then the insurance companies will kick in and say, you know what, this is a medical problem and we'll cover the repair of this problem.
And that is something to keep in mind, that it's not just purely cosmetic.
Absolutely.
So it can have some health, can cause some health problems.
Absolutely. If left unchecked, it'll develop into what we call chronic venous insufficiency, which can lead to big bulging veins that can bleed and develop ulcers in the skin.
All right. Well, thanks for being with us.
Thank you.
Until next time, I'm Kim Barnes.
Call 726-0599 today for your free screening.